report from government agency Public Health England suggests people of Bangladeshi origin are most vulnerable, with twice the risk of death from COVID-19 than whites from Britain. Those who are of Chinese, Indian, Pakistani or other Asian ethnicity, as well as Caribbean or other black ethnicity, had between a 10% to 50% higher risk of death.
There is much more work to do to understand what's driving these disparities and how the different risk factors interact. And we are absolutely determined to get to the bottom of this and find ways of closing that gap.
The findings of the report, published earlier this month, support similar studies in the United States and Finland.
This is a worldwide observation. It's not an observation unique to the UK. The United States, they're seeing more BAME people being affected by this disease. So there is a suggestion, and I have to be very explicit, a suggestion that BAME individuals may have a genetic predisposition that makes them more susceptible to the disease.
Other scientists believe the causes are rooted in societal inequality and cultural differences.
Social status, the way people are being congested in multi-generational occupancies, and the overall exposure BME group has in the community.
Amer Awan, who is of Pakistani origin, lost his father to COVID-19. He suspects cultural practices are to blame for higher death rates.
Sometimes you have brothers and sisters all living in 3-4 houses next door to each other, and they're just probably very oblivious to the fact that this thing is so serious, but they didn't take much notice of that. They were literally going into each other's houses. I know the fact that when the government closed down mosques, for example, but the inside in the community, some people inviting people into their houses and let's do the Friday prayers here.
Ethnic minorities may also be concentrated in certain high-risk occupations to contract COVID, such as in the medical field.
For example, 13% of the UK population is BAME. It is more than 44% of the NHS doctors. Those are from BAME group. So we can still identify that the Pakistani, Bangladeshi origin, they are more exposed and having more severe impact than the Chinese and the Indians have. So that also highlights that the genetics is probably not the major difference.
That suggestion comes at a tense time, with Black Lives Matter protests erupting in the United States, Britain and around the world. Scientists say there needs to be much more investigation, and it's too early to pinpoint what is to blame.